probably a bit repetitive from the last speaker, but my question deals with the same 105 billion, or lots of money, that the previous Congress appropriated in advance. I didn't realize that this Congress can bind the next Congress to an appropriation.
You can, yeah.
I work in the school system, and we're not allowed to do that.
No.
We have something called a non-appropriation clause in our contract. So how do we get around what they did and fix it in the future?
Here, let me, 2.5 months I've been in Congress, and one of the things that I've learned is Congress operates very, very differently than the rest of us. They also have a printing press. We don't. So you know what? We have to be responsible. We have to balance budgets. And again, it's not easy. As mayor of Manchester, it was not easy always to balance budgets and keep taxpayers in mind about how we spent dollars. But you'll hear two terms quite a bit: discretionary and mandatory. I talked about it prior to November. And I feel that every dollar is discretionary. It's your money, it's taxpayer money. Those two terms, what they mean in legal terms is discretionary is essentially operating money that's not codified in law. When you hear mandatory, it's spending that has been codified in law, and the only way that you can prohibit that spending is to repeal that law, not just in the House, in the Senate, but then also get the President to sign it. Operating is how much are we going to fund X agency? We have the ability to fund it at $0, $50, or $100. Anything that's codified in law, we need the House, the Senate, and the White House to execute any reduction in spending in that. The health care bill that the President proposed is all codified in law. So that is the crux of if you want it repealed, the crux of the problem is not the House, because the House has already stated its will. We've been very clear that we don't think that that bill is in the best interest of the nation. It was the first vote that we took, and we voted to repeal it. We sent it to the House, to the Senate, and the Senate said we disagree. So to answer your question, you need a House and a President that would also agree with the House. Now, I'm quite certain the President, our current President, doesn't agree with repealing his own piece of legislation. But one of the things that he did say, if you go back and read his State of the Union, he even joked about it a little bit. And he said, gee, I understand that there's some frustration with this health care bill. And he said that he is willing to work with the House on modifications. Now, the House's position has been, we're not for modification, we're for full repeal. But we will work with you on components that make sense. And he named a couple in his speech. He talked about medical malpractice reform. Now, that has been a no-brainer to a lot of people for a long time. He is now claiming that he is willing to work with us on that. So that component is also, regardless of whether we have his health care bill or another health care bill, medical malpractice reform will reduce your costs. Will absolutely reduce your costs. He has now opened the door to purchasing across state lines, something that I've been talking about for about 1.5 years now. And you know what that does? It gives every person in this room flexibility and choice. And I talked about a gentleman quite a bit over the last year, Carl Thibodeau, the owner of a tool and die company up in North Conway. He showed me a policy that he had from Arizona that saved about $200 per month per employee. Small business, about 35 employees. And what he said to me is, Frank, I had to lay off a certain number of employees, which he just hated to do, because these are people who live in the community. And I said, well, if you had the option to buy a health insurance plan in Arizona, what would you do with that savings? He said, first, I could hire people back. And second, we'll continue to have more choice in reducing that component of our budget. The largest growing component of a budget, municipal, home, or business, is health insurance. Everybody knows it. But I don't think we should have replaced the system with something completely different. I think we needed to be targeted and focused on the costs, the cost drivers of the increases of health insurance. And I think a lot of us agree substantively on that. So let's get together on the things we agree on, get those things passed. And if you can get President Obama to say he's for medical malpractice reform, I think most people know where the House stands on that. We are for medical malpractice reform. We should be able to get it done.
Next question is from Don from Hampstead, and he wants to know why there are so many workers being laid off.